Have you noticed that after 40 you bruise more easily? And those little bumps seem to take forever to heal? Maybe you wake up with a bruise and can't remember bumping into anything, or a tiny cut lingers for weeks instead of days. It's tempting to shrug and say, I'm just getting older. But here's the truth. While some change is normal with age, persistent bruising and slow healing are often your body's way of asking for support. Today, we're going to unpack what's really going on: hormones, collagen, circulation, nutrients, and the practical steps you can take to help your skin and blood vessels bounce back faster. First, a quick roadmap for where we're headed. We'll talk about why bruising and slower healing become more common after 40, the hidden roles of estrogen and collagen, how stress and inflammation can slow repair, the specific nutrients that matter most, lifestyle shifts that make a real difference, and the red flags that tell you it's time to check in with a clinician. By the end, you'll have a simple plan you can start today. Let's begin with the why. Bruising happens when tiny blood vessels, capillaries, break and leak a little blood under the skin. Healing is your body's repair crew: platelets, clotting factors, immune cells, collagen builders, all coordinating to seal, clean up, and rebuild tissue. After 40, a few things change in that system. One big player is estrogen. Estrogen isn't just about reproductive health, it's also anti-inflammatory and helps keep blood vessels elastic and skin well-structured. As estrogen declines in perimenopause and menopause, the protective cushion around vessels thins out. Those capillaries become more fragile, so small bumps can leave bigger marks. You're not clumsy. Your tissue scaffolding simply isn't as reinforced as it used to be. Next is collagen, the protein lattice that gives skin, connective tissue, and vessel walls their strength. Starting around our 30s and accelerating in our 40s, we naturally produce less collagen, roughly 1 to 2% less each year. Less collagen means less structural support for capillaries and slower tissue rebuilding after an injury. That's why a bruise looks darker and lasts longer, and why a paper cut that once healed in 3 days now takes a week. Circulation also changes. With age, we often move a little less, spend more time sitting, and experience subtle declines in blood flow. Slower circulation means fewer nutrients and oxygen delivered to an injury, and slower removal of waste products, both of which can delay the repair process. If you notice your lower legs bruise easily and marks linger there the longest, sluggish circulation and venous return can be part of the story. There's another angle that often gets overlooked: nutrient delivery and absorption. Even with a solid diet, we tend to absorb certain vitamins and minerals less efficiently as we age. The usual suspects for bruising and slow healing include vitamin C, critical for collagen synthesis; vitamin K, important for clotting and vessel integrity; zinc, needed for tissue repair and immune function; and iron, essential for healthy red blood cells and resilient skin and vessels. If intake is low, digestion is off, or absorption is reduced, your repair crew may be undersupplied. Hormones beyond estrogen also weigh in. Cortisol, the stress hormone, has a direct impact on healing. When cortisol stays elevated, it breaks down collagen, slows the immune component of wound repair, and can raise blood sugar. Over time, unstable blood sugar and insulin resistance stiffen blood vessels and feed inflammation, which makes bruising more likely and healing more sluggish. If you're navigating midlife stress, disrupted sleep, and on-the-go meals, that hormonal cocktail can quietly work against your body's repair systems. So, how do you tell the difference between expected changes and inflammation-driven trouble? Here are some simple clues. If stiffness or tenderness around a bruise improves with light movement and the mark fades steadily over 1 to 2 weeks, that leans toward normal aging and minor tissue fragility. But if you're seeing frequent bruises with no clear cause, bruises that are large or painful, or morning stiffness and swelling that last for hours, those can be signs of inflammation rather than simple wear and tear. Symmetry can be a clue too. Bruising or pain that shows up on both sides, like both shins or both hands, without an obvious reason may point to a systemic driver like low-grade inflammation or an underlying condition. Now for the empowering part. Targeted nutrition can make a noticeable difference. Think of it as refueling your repair crew. Start with vitamin C. It's the cofactor your body uses to weave collagen together. Load your plate with bell peppers, citrus, berries, kiwi, broccoli, and leafy greens. If you like numbers, A cup of strawberries and a half bell pepper easily cover a day's baseline needs. Vitamin K matters for healthy clotting and vessel strength. Dark leafy greens, kale, spinach, Swiss chard, plus broccoli and Brussels sprouts are excellent sources. If you take blood thinners, keep your intake consistent and coordinate with your clinician rather than making big swings. Zinc helps immune cells and skin cells divide and rebuild. Pumpkin seeds, lentils, chickpeas, and beans are great staples. If you eat animal protein, oysters and beef are top sources. Iron supports oxygen delivery and vessel resilience. Pair plant sources like spinach and lentils with vitamin C-rich foods to boost absorption, or include iron-rich animal proteins if that fits your diet. Don't forget protein overall. Repair is a protein-heavy job. Aim for a meaningful serving at each meal. Think Greek yogurt or tofu at breakfast, beans or fish at lunch, chicken or tempeh at dinner. Most midlife women feel best with roughly 20 to 30 grams per meal. Round things out with hydration, water literally moves nutrients to the work site, and consider flavonoid-rich foods like blueberries, citrus peel, dark chocolate, and green tea, which support capillary integrity. Lifestyle shifts really do amplify those nutrition wins. Movement is medicine for blood flow and tissue strength. Low-impact cardio, like brisk walking, cycling, or swimming, improves circulation, while strength training twice a week stimulates collagen production and builds the muscles that stabilize joints and protect vessels. If you find yourself sitting for long stretches, set a gentle timer to stand and move every hour. Even just 2 minutes helps pump blood and lymph. Sleep is your body's nightly repair window, so prioritize a consistent bedtime, a dark, cool room, and a wind-down routine. If midlife sleep feels elusive, try experimenting with earlier light exposure in the morning, limiting caffeine after midday, and a calming pre-bed ritual, like stretching, breathing, or reading. Stress management isn't optional if healing is your goal. Daily, doable practices, 10 slow breaths, a short walk outside, journaling, or a warm bath, help keep cortisol from staying chronically high and allow collagen building and immune repair to get back on track. Protect your skin from where you can control. Moisturizing helps maintain the barrier and reduces micro tears. Sun protection preserves collagen banked today so you have more resilience tomorrow. If lower leg bruising is an issue, elevating your feet at day's end or using gentle compression with your clinician's okay can support venous return. It's also worth scanning for medication contributors. Aspirin, anticoagulants, corticosteroids, and even some supplements can increase bruising. That doesn't mean you should stop them, never do that without guidance. But bring a complete list to your clinician and ask whether timing, dose, or alternatives could reduce side effects. When should you seek medical evaluation? If bruises appear suddenly and frequently without clear cause, if they're unusually large, painful, or clustered, if small cuts take months, not weeks, to heal, or if bruising comes with other symptoms like fatigue, dizziness, shortness of breath, or frequent infections. It's reasonable to ask for basic labs, a complete blood count, iron studies and ferritin, vitamin D, a basic metabolic panel, markers of clotting like PT-INR and APTT, fasting glucose or A1C, and based on your history, vitamin C, vitamin K, zinc, thyroid function, and liver tests. The goal isn't to chase every number. It's to rule out correctable issues and get a clear picture. To make this practical, here's a simple 7-day repair support framework you can repeat. Day 1, stock your kitchen with color berries, citrus, bell peppers, leafy greens, cruciferous veggies, legumes, and a few quality protein options you enjoy. Each morning, anchor breakfast with protein plus vitamin C, Greek yogurt with berries, a tofu scramble with peppers, or a smoothie with protein powder, spinach, and pineapple. At lunch, build a plate with a lean protein, a big handful of greens, something orange or red, and a whole grain or legume. At dinner, rotate proteins and pile on vegetables. Add a drizzle of olive oil for absorption and satiety. Walk daily. 10 to 20 minutes after meals is wonderful for blood sugar and circulation. Strength train 2 non-consecutive days. Focus on full-body basics like squats, rows, presses, and hinges. Create an evening routine that tells your nervous system, we're safe. It's time to repair. Lights dim, screens down, a few stretches, then bed. Within a few weeks, most people notice less frequent bruising, quicker fading, and fewer, why is this still here? Scrapes. And if you don't, that's valuable information to bring to your clinician for a deeper look. Let's recap. Bruising more easily and healing more slowly after 40 are common, but not always inevitable. Estrogen decline and collagen loss reduce vessel resilience. Nutrient gaps, especially vitamin C, K, zinc, iron, and adequate protein, can slow repair. Stress, sleep loss, and unstable blood sugar raise inflammation and delay healing. The solution isn't to accept every new bruise as just aging, but to listen to what your body is asking for and respond with targeted nourishment, movement, sleep, and stress care. Small, consistent changes really do compound. If this resonated with you, I'd love to hear your experience. Have you noticed more bruising or slower healing since 40? What's helped and what hasn't? Your story might be exactly what another woman needs to hear. At Leap 2, Better Health, we help women over 40 uncover the root causes behind symptoms like easy bruising and slow healing, then build practical, science-based plans that fit real life. If you want a personalized approach, book a free consultation today and we'll map out your next best steps together. If you found this helpful, like this video, share it with a friend, subscribe for more midlife wellness guidance, and leave a comment with your questions. Choosing informed care is how we repair, restore, and reset at any age.